And briefly, for the ones that haven't heard yet, because this happened not even 2 weeks ago, for EGFR Exon 20, we have Sunvozertinib approved July 2nd. Exon 20s are rare, everybody's familiar with exon 19 and 21, the most common EGFR mutations, but exon 20s are important because they do not respond to the standard of care of osimertinib here or in Asia, icotinib, the most commonly used drugs in the world. And you can see here the position of these mutations. The most common exon 20s are 770, 771, 774, 773. And they probably together may go up. Sometimes people say 12%, other series says a little bit less, but maybe the easy way is to say, okay, they are around 10%. They are 10% or something. And the other thing is there are a lot of these different mutations. So that's why we always recommend NGS, because if you do PCR, you may not catch all of this, and you maybe miss one of these. That's why I think it's better to do NGS, so if the patient has one of these, for sure we're going to find them. The study that supports the approval is a study called UCON-1B. These were patients with locally advanced metastatic non-small cell lung cancer. They have a confirmed EGFR Exon 20 insertion by the locally or by the sponsor of the study. And the patients, were already treated by platinum-based chemotherapy. Remember, for exon 20s, the standard of care until recently was chemo, everybody used chemo. And now there is approval of chemo plus amivantamab. But in this study, probably, because it took probably 2 or 3 years to be done, these patients only had chemo, So they had chemo, and then they were placed on this drug, sunvozertinib. There were 2 doses. Finally, the doses that we are using as standard so far is 300 milligrams daily. The end point was overall response rate, and you can see the overall response rate is 53%. And as I say again, you can still add 39% on the bottom of people that has a stable disease. So in other words, close to 90% of the patients, once that you put them on sunvozertinib, benefit from this treatment. Yeah, so it's very good for a very hard to treat mutation that doesn't respond very well, and includes, as I said, a lot number of genetic aberrations that are inside the exon 20. The duration of response is around 9 months. So that is why this is another option for the patients, and even people that had amivantamab can still benefit from that. And of course, we have a lot of questions that, okay, how about if you use this first, the patient will still respond to amivantamab later? Probably yes, but we need to get more experience because amivantamab was approved recently, and this one is just approved. Finally, the safety, very important, because, we are going to give this new drug, how safe it is. You can see the toxicity profile, diarrhea, elevation of CPK, anemia, rash, a little bit increase of lipase. I know some of you will be wondering of CPK elevation or what it is. Right? We have other drugs like brigatinib that we have CPK elevation, and really some people forget to check. It's in the label, by the way. But it's important to track and do something about it. The CPK gets elevated, hydration and other things, or maybe give a break from the drug. But there are no red flags so far. I know this is a small study. Probably I'm not an expert, but this approval probably is conditioned to another study. But so far we're happy that our patients don't have to endure any complicated or weird adverse events so far. And so this is it. Happy to be with you again in the future. So the most important thing with these new drugs is testing. The only way that we want to benefit our patients is if we do more testing, so we can find more patients that can benefit from all of these new agents. Thanks to Grace for the invitation, and please look other Grace videos. We have a huge library in English, in Spanish, in Chinese, and all of this is done for you, so for your benefit and your knowledge. Have a great day.